how is everybody? My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over 10 tips for back pain so you can get through the holidays or vacations or whatever you have and hopefully not be in too much pain. Unfortunately, the holidays, traveling, really, the more vacation time we seem to have, a lot of times the more back pain we seem to incur. With COVID and everything settling down somewhat, people are starting to return to the office, which means there is a change in work environment, and usually that means some type of back pain associated with it. We all converted to home, now we're going slowly back into the office, most of us, and we are now trying to figure out our positioning. So I'm going to give you 10 tips to deal with back pain. So we're going to be stretches, and we're going to be just little comments that we're going to talk about. So the first thing for back pain is you want to make sure that you are changing position often. If you are somebody that suffers with back pain, back stiffness, whatever it may be, whatever you may call it, you don't want to be sitting, standing, laying down, anything for too long. Obviously, going to sleep, that's allowed. Otherwise, you want to make sure that you are changing positions about every 15 minutes. I know that sounds excessive, and when you get caught up in work, you can get a little bit carried away, but you want to make sure that every 15 minutes you're just standing up. Maybe you have that sit-to-stand desk and you're easily from one position to another, but make sure you're not doing any position for too long. Movement is actually the best thing for back pain. That's the second tip. When you do have back pain, a lot of people like to lay on the back, lay down, stop moving. And really when you have a spasm or there's some type of pain in your back, the best thing you can do is just nice, gentle movement. We have aquatic therapy here that a lot of our back pain patients do because the movement and the heat actually help. So you can look at our channel on YouTube, Total Performance Physical Therapy. You can see posture videos, but you want to make sure that your back is in good position, and you want to make sure that when you're standing that your butt's not sticking out, or if you're sitting, you're not slumped over like that. Extremely important because that is going to drive the healing process of the back. You cannot come to physical therapy, you cannot have injections, you cannot have surgery and go back to poor posture. It is imperative that before you do anything or while you're doing something that you're also correcting your posture. Sitting on the couch, slumped over, watching TV. Again, not advisable when you're dealing with back pain. You need some type of support that allows you to keep your spine in neutral. That brings me to tip number 4, which is your head is going to drive where your low back is, and a lot of people don't understand this concept, and it makes for back pain to be precipitated by things that you don't even realize. So what I mean is when you're looking at your phone and you're down like this, most people just think that's going to affect my neck, but when you're in this position, it affects from the neck all the way down to that lumbar spine. The spine is all connected. So you need to make sure that you are using your neck or having your neck in the proper position. That's going to affect your back. And most people don't realize that. They're just constantly thinking about how the back needs to be positioned. But if your mouse is out here, there's no way your back's going to be in good position because you're reaching, you're stretching, you're using all of those muscles down on the side of your back to reach your mouse. So that's just one example, but make sure everything when we're talking about posture is in good position. Most people tell me, well, I'll just look down with my eyes. If you start to look down with your eyes, your head follows, and then your low back follows. So, and really important. Next tip, number 5, is you want to make sure that you are doing some type of stretching or foam rolling daily. Now, again, we have tips on our YouTube channel, Total Performance Physical Therapy, that go through low back stretches, that go through a foam rolling program. If you wake up with low back pain, if you suffer with low back pain, just taking an Advil is not going to do anything. You actually have to be proactive in doing things to alleviate the pain. So getting on a good foam rolling program, getting on a good stretching program, that's going to help eliminate that back pain. So make sure you're actively doing something in order to make that back pain go away. Now we are on tip number 6. So when you are driving, this is a really tough one because so many people, while commutes have gone away, they are still there and people are driving for a long period of time. You want to make sure that you are adjusting your position as much as possible. So just kind of sitting there with your leg out, can be very detrimental. So, you know, as you can at stoplights, switch your feet, put the left foot on the brake, just take a stretch. You can do some cat-cows where you're just kind of flexing and then extending while you're sitting in traffic. Make sure that you're just not sitting there. Driving can be tremendously difficult on the back. Next tip, number 7, how you sleep. Important, super important when it comes to back pain. At night, this is when your body gets its chance to heal. When you're suffering with back pain, you don't want to sleep on your stomach. You want to make sure you're sleeping on your back or on your side. And again, we have several videos that will show you how to properly position yourself, but you have to be able to recover at night. If you're jamming your back up into extension because you're laying on your stomach, you're really going to cause yourself a lot of pain. So be aware that a sleeping position and how you sleep is really, really important. Next tip is number 8, numbness and tingling. So a lot of times back pain can progress to numbness and tingling. When you have that numbness and tingling, whether it be just in your big toe, whether it be all the way down your leg, this is a warning sign that something serious is going on and you need to really pay attention to it. It can be a nerve, it's usually a nerve issue. It could be coming from your disc, it could be coming from a muscle issue, it could be coming from a lot of things. But you want to make sure that you address that because that numbness and tingling can lead to weakness. Sciatic is a common term that's used for it. It could be a herniated disc. But whatever it is, you want to make sure you are addressing that numbness and tingling, not ignoring it. I know so many people who just kind of shake off the numbness in the big toe, and it will get worse. And unfortunately, the quicker, the longer you let it go, the more damage you're doing to your body. And nerve damage can oftentimes not be reversible. So make sure you're addressing things as they come along. Tip number 9, it is very, very important that you make sure that as you get up out of bed, if you are dealing with back pain, that you do not sit straight up. Or if you're just laying down, that you don't sit straight up. You want to avoid putting stress directly on the back. So if you're someone who has that back pain, you want to avoid just sitting straight up. You want to avoid twisting motions where you're really using that back to help you do certain activities. Super important that you realize that when you use your back and you don't engage your abdominals, you will cause yourself more back pain. Final tip, having a strong core, stomach, abdominals, hips, all of it is important to have a healthy back. You cannot get better from back pain without having a stomach support. The stomach is the support for that lumbar spine. If it is not strong, it is not going to be able to support that low back. Therefore, your low back will continue to hurt. And those braces that they have, while they may help slightly, they're not the end all be all. So you need to make sure that when you are fixing your back pain, quote unquote, fixing your back pain, you are doing core exercises and stabilization exercises as well as that stretching and foam rolling to make sure that your back has some support and isn't going to collapse. If you or someone you know is suffering with back pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.